Well, thanks everybody so much for being here this morning and letting me speak. Usually I'm deeply prepared, 15 PowerPoint slides, all fancy, all that kind of stuff. 2 slides today. We'll get to those in a minute. But before we do that, maybe I'll introduce myself for a second. And then that'll give you some context for where maybe some of my comments come from. So again, I'm Paul Brown. Last May, I retired from the role as the Chief Information Officer for Henry Ford Health System. Since then, I've been working about a day or 2 a week with the health system, with the Henry Ford Innovation Institute and Henry Ford, about technologies that maybe won't come to fruition for 5 to 7 to 10 years. But over that horizon really could be huge game changers in healthcare. And there's a particular domain I'm very interested in called bioconvergence, which is really the converging of traditional computer science with medical science, biology, physics, etc., and creating some very, very exciting things. In fact, if any of you saw, I'm sorry to say this with the Michigan State crowd, but if any of you saw the Detroit News this morning, there was a pretty nice article about some work that's being done at the University of Michigan with computer brain interfaces and intelligent prosthetics that actually allow people to move prosthetic limbs by thinking. And you know, this is a pretty exciting restorative kind of opportunity, and there are a number of things out there. They probably won't come to mainstream use at scale for quite a number of years. But if you think about how that could change healthcare for people, for elderly people and others, you know, that's pretty darn exciting. So I am trying to stay engaged in the industry from a perspective of helping people stretch their thinking far out into the future. And as an innovation group, one of the things I wanted to leave you with today is please don't get discouraged, because there's not very many people actually in U.S. health systems who are thinking far into the future. There's so much pressure right now that people are really focused on this year, next year, and kind of survival. But we need an innovation ecosystem that's extending the thinking, you know, much further into the future. And on that journey, as innovators, you have to engage and interact with the established ecosystem of players and technologies. That's very difficult to do, and in a minute I'll get to sort of Paul Brown's top 10 tips on how to help make that happen. But before I was at Henry Ford, which started in 2018, I was the Chief Information Officer at Tenet Healthcare, which is a $20 billion a year health system, for-profit. It's a little bit different. Prior to that, for 12 years, the Chief Information Officer at Trinity Health. Prior to that, the Chief Information Officer for 2 health insurance companies. So 35 years leading the technology division of large healthcare companies. Now you might be tempted to look at me and go, you're the problem, dude. It's your fault that we have this hot mess on our hands. And I don't know, maybe that is the case. I don't know for sure. But I was thinking on my drive in, when in my career perhaps was I my most innovative? And I have to think it was probably about 25 years ago when there was a really novel idea at the time that if you had hospitals all over the country that were part of a single health system like Trinity Health, then the way we treat a pneumonia patient in Silver Spring, Maryland ought to be pretty much the same in Fresno, California. But it wasn't that way. There was huge variation. And so the innovation was, can we accelerate the knowledge transfer within healthcare? Typically, scientific breakthroughs in healthcare take 17 to 20 years to disseminate fully in healthcare. So could we create a technology platform that really accelerated that? And the idea was a common electronic medical record with clinical decision support across 40 hospitals across 20 states. I spent 3 years selling that idea. I spent 3 years on an airplane, traversing the country, going back and forth, trying to encourage people. You know, and finally we got there, and we were able to make it happen. It was, you know, circa 2005, 7, like that. You know, what the hell did it do? Yeah. But then COVID comes along. And our care protocols are changing literally every single day. And those platforms became a great vehicle to disseminate knowledge very, very quickly and treat people very well. And so one of my thoughts about innovation is, you may have an idea today, we're going to go fix this, we're going to go work on that, but you don't really know what it'll turn into and where it might have effect. And don't let that slow you down, don't let that stop you. You know, create the idea, let it come to life, bring it to fruition, and maybe it'll become something else. And when I was traversing the country selling this idea, I would use the example oftentimes of the Transcontinental Railroad. So the idea of the Transcontinental Railroad, which basically ran from Iowa to San Francisco, was first introduced to the U.S. Congress in the 1830s. Construction started in the mid-1860s. Took 30 years to build momentum and alignment on this idea. Anytime there's a new innovative concept, it takes a lot of energy. It took less than 5 years to build it, 30 years to align, 5 years to get it done. But I think one of the most interesting things about it is historians think that perhaps the most significant outcome of it was the improvement of public health in major U.S. cities on the East Coast. You go, what? Well, there was finally a platform by which you could move fresh fruits and vegetables grown in the western United States to the East Coast. People's diets improved substantially, and you see in public health statistics, life expectancy in the U.S., start to really improve in the late 1800s. So again, this idea of with innovation, we don't know at the outset where this might go and what the impact might be. But the point is, we try new things, we try to solve problems, and we try to move ahead. So I used to like to use that story, and again, I want to encourage all of you, those of you who are innovators, entrepreneurs, and those of you who help those folks, be encouraged by that. I don't know how many of you in the last 3 years have lost a loved one, someone close in your life to disease or illness. If you have, you've become intimate with the U.S. health system, and I think you would have to admit it's in pretty rugged shape. It's disjointed, leaves patients and families frustrated and often feeling vulnerable. And that's why we need innovation. We need places like this. We need people like you all really working hard to try to make that better and improve that. And so what you do makes a difference in people's lives, and it will, ultimately. And then the last thing I'll share about innovation from my point of view, and then I'll get into sort of some tactical nuts and bolts, things. I got a chance to travel overseas, a few years ago and get exposed to some leaders in a country that's known for quite a bit of innovation. And, what they talked about was, sort of how innovation, permeates their culture. And I like these thoughts to be shared. And one thought they shared was from a very young age in our country, if a child has an idea, rather than people saying, oh, that's not realistic, they say to the child, change reality. Don't just accept that something's unrealistic. Try to change reality. So I thought, let's not limit ourselves to what our current, reality is. And another thing, that kind of struck me about that trip was, sort of commentary that we don't count success based on breakthroughs or inventions. We count it based on attempts. How many times did we try? Let's just get in the game and keep swinging and keep trying. And so for all of you who are entrepreneurs, inventors, please keep trying. We need you. For those of you who are around entrepreneurs and inventors, continue to encourage and support and help folks, because we as a society, we as a world, we have a lot of needs in healthcare, and we really need serious breakthroughs. So I'll get into some really tactical things, because for 30, 35 years, I sat across the table from entrepreneurs and investors and
I can spare 20 minutes in my busy day to listen to your pitch. And, I have to admit a lot of times I was kind of, crusty, not as open-minded as I should be. I'll try to atone for those sins. But just some things for you all to think about, because even with the Transcontinental Railroad concept, even before that, that was spawned from the Louisiana Purchase, which was kind of spawned from Lewis and Clark doing exploration, which was kind of spawned from fur trappers and traders in the 1600s. So there's all these connections, right? And as inventors and innovators, at some point you need to connect with and engage with existing technology ecosystems. And so there's some ways, things you can do and things you can avoid that might make that engagement and that connection a little easier or a little harder. So one, start with the basics. I cannot tell you how many times I sat and listened to a pitch, and 20 minutes in, I'm like, who specifically is going to use this solution that you're creating? And oftentimes the pitch person didn't really know. I mean, it was sort of like, this seems like a good idea. But knowing who specifically will use the solution and how will it make their job easier. It sounds so incredibly basic, but it got missed so many times. And my advice to inventors and entrepreneurs would be, if you don't know that, it's okay. Go sit with the people who you think will use this and just watch how they work every single day. It's amazing how crystal clear certain things become. So, start with the basics of who specifically would use this particular solution and how does it make their life better? Because if you can't answer that, then it's sort of, kind of a non-starter. And I think comes from that is kind of being very clear about the value proposition of the solution. How does it make that person's job or life better? And then at what scale and what magnitude? Do the math. Is it number of transactions? Is it minutes saved? What is it? And that becomes the value prop. And when you think about the value prop, oftentimes we think financial. It's usually pretty important. But think also about quality. Think about changing outcomes, improving preventive care, et cetera, et cetera. And there are other elements of value prop too, patient satisfaction, physician satisfaction, et cetera. But be clear about it. Don't be fuzzy. Just, this is what we think. And with your value prop, be also very clear about this is a hypothetical value prop, based on math we've done versus we've proven it in 3 places versus we've proven it in 10 places. It's okay. Just be really clear about where you stand. Understanding risk. Okay, a lot of crusty guys like me, you'd come in, pitch, and you'd be like, why is he so worried about this? Come on, man, what's all the risk you're talking about? Well, we're not Amazon, using AI to help you find pants you like. Like if that model goes wrong and it's wrong 5% of the time and you wind up with pants you don't like, okay, I gotta return them, it's no big deal. Where's Whole Foods? I'll go drop them off and get some organic carrots, it's all good. In healthcare, if an AI model's wrong 5% of the time, people can die. People can be seriously harmed. And even if it's just a financial tool, people can go to jail. I know people I worked with who went to jail because they were accused of fraud by the federal government, because models they used in ED coding, seemed skewed to higher levels of intensity, higher payment. So when you sit across the table from healthcare people and they're saying, I'm concerned about the risk, just be aware they're living in a world where the wrong move, people get hurt, the wrong move, people go to jail. And so they're hyper-focused on risk, kind of appreciate that. Integration with established tech ecosystems. So every health system in the United States today is using some technology to do some things. And most of them, quite frankly, are working very, very hard to narrow that technology portfolio, because the history of healthcare technology in the US has been a ton of fragmentation, a ton of one-off solutions. They don't work together, they're hard to handle. And every one of those creates cyber risk today, sustainability, all kinds of issues. So think very hard about how your solution, if it's technically oriented. Do you know how it would integrate with Epic? Do you know how it would integrate with Cerner? Is it Microsoft Azure? Is it, Amazon? Be able to think through how your solution integrates with other things. It's not a good word to use in healthcare, but there's a lot of IT leaders, rightfully so, trying to euthanize technology solutions in their world today, and they're loath to add things that are perceived to be one more one-off. So the more you can come in with the case of here's how my thing fits into other things in your world, the more successful you'll be. IT involvement, if you come in, say anywhere to anybody, IT doesn't need to be involved, you're just no longer my friend. The walls go up instantly. And honestly, it's dishonest, right? Everything in some way, shape, or form involves integration with a security environment. At some level with data, at some level, it may be minimal, but there's always some level, and at the end of the day, the IT leaders are accountable for whatever that solution is, even if it's yours. So it is okay, I think, to say we've intentionally designed whatever we've designed, so it's minimally technology involved, or it requires minimal technology. To say you've designed it in a way where it minimizes the intensity of IT, that's a good thing, that's positive, that's a thoughtful thing. But don't diminish that, or you'll just shoot yourself in the foot. I would say relative to security and privacy, for many, many years, as I heard pitches, it was very clear that security and privacy were an afterthought, if at all. I would say they're table stakes. I would say no matter what your solution is, you need to come in and say, here's what we've done to design security in, here's how we've thought about it, here's the research we've done. There's certificates you can get, there's various things, but just to even demonstrate at the early stage that it's been a significant consideration and how, demonstrates a lot. That means a lot to folks. Being very honest about the maturity level of your solution. Again, I sat through many, many pitches, half hour in, I didn't know, are you talking about a concept? Do you have a minimally viable product? Do you have this live in 5 places? Just be clear, and it's okay. It's okay if it's a concept at this stage, But being real clear about that, don't try to BS around it. It's okay even if it's a concept or it's in one place or it's in beta or something. Just don't try to make it sound bigger, than it is. Demand versus supply of IT resources. You may run into a lot of hesitancy for people to engage. It's not because they're mean or they don't like new things. Unfortunately, in most health systems in the US today, IT is still thought to be a cost. CFOs, CEOs, no matter what they say, they don't think like an Amazon or many commercial companies that truly believe that investment in IT is a way we create new products and services, we can drive new revenue, therefore we should do it. Or we really can lower the cost of manufacturing, a transmission by 50% because we can automate X. Right, wrong, or indifferent, most health system CFOs and CEOs still look at IT as a cost that's too high. And so as CIOs, you're constantly trying to find ways to just keep your current environment operating and steady and stable. And that's a real issue that you'll run into as entrepreneurs and inventors, and it's why you have to be really crisp about that value proposition and whether or not it's a value proposition. If you don't know healthcare economics, one of the really unfortunate things about healthcare economics is most of the revenue that comes to health systems is either coming through Medicare or Medicaid or pricing structures that are heavily influenced by Medicare and Medicaid. And what that means is health systems do not have the ability to say, hey, you have a great technology solution to, for more patient engagement. That's a really great thing. We can add $2 per month on our price and make up the cost and make a profit of it. Health systems have no ability very minimal ability to influence price. We're price takers is what economists would say. And so you're saying, well, it's a small investment to start this thing up. And it's like, well, I can't get any more revenue for it, period, done, unless it attracts brand new customers. So you really do need to really think seriously about, can my solution get cost out somehow? Because that is going to be the prime driver. Alignment. So as you think about your solution and who would be using it, within a health system, there are generally 3 groups of people that you would need to get aligned to move forward with investing or using your solution. One would be, who's the person who's actually going to use it, and who's the boss of that group? So let's say you're coming up with some great way to do care coordination. You have to ask, who within Henry Ford actually does care coordination? Who is their boss, maybe their boss's boss? And does this person see what I have to offer as a benefit to them? That's one group. Another group is IT, because IT is going to say, does this fit within our current portfolio? Can we stand this up readily? Can we make it secure? Can we interface it? Can we do all those things? So is there a technical fit? Kind of the first one is there a function or workflow fit? The next is there a technical fit? And then finance will have an interest in sort of what's the financial model behind this? How much does make our costs go up? And how do we compensate for that? So as you think about approaching health systems and sort of selling in your solution, don't go, oh, we had an awesome meeting with the case management people, we're done. You got to think about, how do I align all 3 of those elements to be able to move forward successfully? And then the last thing I would say is persistence is really good. Not pestering. Pestering's like calling Paul every week and saying, I know it wasn't perfect for you last week, but maybe this week it is. But there's so much in health systems that's the right solution coming into the system at the right point in time. There's these little windows of time that are kind of unpredictable. And so I think one thing about being successful is getting yourself introduced and then being willing to say, okay, maybe the timing's not right. Can I call you back in 6 months? And let's talk again. And maybe you've evolved more and maybe the health system is more ready. But keeping that dialogue open. And I think, 3 to 6 month check-ins is really good. In my role now, I do a lot of meetings with early stage companies. And one of the things I like to say up front is my job is to help us figure out from a Henry Ford perspective relative to what you have to offer. Is your solution compelling and we have a compelling need right now? Okay, then we should be talking more. Or do you have a compelling solution but the timing isn't right, so we should stay in touch, and talk again in 6 months? Or is your solution just not compelling in our environment for whatever reason, and I wish you the best of luck, and I don't want you to burn more cycles, and we don't want to burn more cycles. So my goal now is, I tell people, I want to try to get you and us to one of those 3 buckets as quickly as we can, so you don't waste your time, we don't waste our time, and we go on from there. So with that said, I will just say thank you for everything that you all are doing. Keep at it. The world's going to beat you up and bloody your noses, and things will take way longer than you would ever possibly expect. But we need the inventors, we need the entrepreneurs in healthcare in particular. and just be open to that notion that whatever you're inventing and pushing out there today, maybe it's going to be the public health benefit of the Transcontinental Railroad, maybe it's going to be the COVID benefit of having done common medical record systems, 20 years ago. But please, please don't stop what you're doing, no matter how difficult it might seem. So with that, I don't have anything more, but I'm really happy to engage in any dialogue, comments, questions. Throw rotten eggs at me if you want. I don't. It's okay. But happy to share anything I can.
Yeah. A question for you. You talked about the value prop, and I get it. I understand that. But one of the things that we're also looking at in the value prop is the quality scores and the measurement of those and the impact on the health system. How important is that? Is that a high area of focus versus cost savings? What are your thoughts on that?
Maybe just put a little bit, partners, Paul, a little more spin on that. So there's a tangible, there's intangible, but there's a less tangible, or the delayed tangible. So the outcomes are going to be very important in terms of your Medicare reimbursements and bonuses and all that sort of thing down the road. And how much does that play into it as well?
Yeah. Those are very important elements. I mean, I think when you can show clear line of sight from, improving a quality metric and how it translates into a financial metric, I think that's, very, very helpful. And I think health systems are funny. Most of them don't have a crystal clear quality agenda. They have lots of quality things they want to improve on. I always dreamed that every health system I would work for would have like 10 things on their quality agenda that were crystal clear that people could rally around. But it's more fuzzy than that. But I think if you bring in a solution and you can clearly say, this really has a quality impact, and here's how it has that quality impact and how we can measure it, I think you'll get an audience. I think in many health systems, depending on what it is, they might say, that is an important quality item, but for us in the moment, we're really focused more on these 5 things or 7 things or whatever the case may be. So I would say if you're selling something based on quality, try to figure out, does it link to a broader agenda within that particular health system? Does that make sense? Yes.
So my question is alignment. My background is very technical, AI sort of background.
Okay.
So with the evolution that's going on in AI, it's very important for the audience there to see what are some models that healthcare industry is adopting to create that alignment at different levels. You talked about care coordinator, alignment at that level, and then maybe talking to the boss, does it make sense financially, like all of these things. So what are some models that the healthcare industry is adopting to accommodate the revolutionary change that's going on in the AI to create more and more alignment?
So, and you tell me if I'm interpreting your question incorrectly. My belief, personally, is that the adoption of AI in healthcare in most cases it's a feature within existing software solutions that oftentimes people don't even recognize they're using. And so I would say to anybody who's developing, let's say, clinically oriented AI solutions for healthcare today, let's say diagnostic algorithms or treatment protocol acquisition, you have to say, how am I going to weave that into Epic? How am I going to weave it into my radiology solutions? Because that's one thing healthcare has learned over and over and over again is if you place any technology solution outside of the natural workflow of a doctor or nurse, the probability of it being successful are very, very low. So I think a lot of AI in healthcare is actually going to wind up being commercialized as more content, really, where a model is content and it becomes embedded in ecosystems as opposed to ecosystems in and of themselves. I actually envision a world far in the future where there's libraries full of AI models that are available, and organizations subscribe to them, and those are presented within the context of whatever technology tools those health systems are using. I may be wrong, but did I kind of answer your question, or did I go to the wrong place?
Kind of. My question is more around like how does the healthcare systems facilitate these coordinations between like hospital systems and like care management?
Terribly. Terribly. Honestly, terribly. When I talk about that alignment, a lot of my career as a CIO was spent working on that alignment. And I often wondered, why am I doing that? I'm the technology leader, but I was smart enough to know that if those other folks weren't aligned, that things wouldn't happen. I don't have a good answer for you other than for you all to recognize that the decision-making processes in health systems are very disjointed, very unclear, and I don't know however to fix that, honestly. My perception was, if you're making $1 million plus decisions as a health system, there's enough visibility that people get, around it. If you're making a $50,000 decision, often that's in somebody's budget and it's just kind of buried. I always struggled the most with the $500,000 decisions because they were too big to be nothing, but they were too small to really garner any kind of serious attention and consideration. But I think the best tactic is to try to understand what are the health system's priorities and then how do you link to that? Because, like Henry Ford has an annual operating plan that's pretty clear and a 3-year strategy that's pretty clear. So to the degree your solution can sort of be subsumed within one of those, it makes it easier to have the alignment conversations because at least everybody's heard about this. For example, one of the things at Henry Ford on the strategic plan is really advancing our work in precision health, which is a spin on precision medicine. So to the degree you can bring a solution to bear and say, this is how we think about our solution relative to precision medicine. The finance people have heard about that, the clinical people, the administrative people. Does that help a little bit? I hope?
Yes. And is that sort of information that's available, usually like the prioritization?
It's not crystal clear. And so I would encourage you in initial discussions with health systems to try to elicit from them, tell me a little bit about, how you all are thinking about your current priorities for this year and next year so that I can be honest with you about whether or not what I have to offer seems to fit within that or not. And that's kind of the timing thing too, right? You don't want to be selling upstream.
Thank you.
Yeah. Yes.
Well, question about integration. So integration obviously very important, and to actually come into this, I'm an Epic user or have been for years and all, and so working with Epic has always been very interesting. So you come into an environment where there's Epic, and one of the things we talk about is we want to enhance upon what Epic already does. And what I've experienced in the past, and to a certain extent, currently, is, Epic's going to do that. And I've been hearing that as a user for years, in regards to like differential diagnoses and putting in algorithms for, assessing patients or treatment plans, as you talked about earlier and everything.
Yeah.
What's your best suggestion for trying to get over that hump?
Yeah. So first of all, just to de-epicize it for a minute, if you look at what's going on with big tech in this country, the big players, Salesforce, Epic, Cerner, Microsoft, what they're trying to do is own an ecosystem and then have a lot of different players that plug into their ecosystem, right? So sometimes Epic gets a bad rap because it feels like what you just described, but actually they're all doing it. And done well, it should facilitate. But I think what Epic's been pretty clear about is that they don't really want to be in the business of creating content. And so I think where the entrepreneurial and invention opportunity is, we've developed content, which could be an AI algorithm for doing a different kind of cancer diagnosis or whatever, and owning and selling and licensing that content as the entrepreneur. and having developed it in a way where it integrates well within Epic. And I do think they are getting more quote-unquote open. I think the other thing to think about, and we did this a number of times within Henry Ford, is our thought process was, well, something's on the Epic roadmap, but probably not for 3 to 5 years. Let's find a bridge solution that's really strong, use that bridge solution for some period of time, and then when something's available from Epic, then we can consider whether or not it makes sense to stick with this bridging solution or to transition to the Epic version. And we wound up answering that question differently based on, the situation. So I think it's really an important thing for you all to think through, like, what's the life of my solution if I position it as content versus as a technology solution, and what's my exit strategy become? And 'cause I think they're going to be a houser of content as opposed to, owning. I don't think they want to be in the content business, honestly. Does that help at all?
It went in one direction, so yeah, that's fine.
Okay, all right. And if you want to talk more at some point, happy to do it. And mind you, I may be wrong about all this stuff, so I'm just sharing sort of my lived experience. Other people have lived experience. It does raise, and I'll get you real quick, I tell people a lot of times, when I was at Henry Ford, we were blessed to have a very homogeneous technology ecosystem. When I was at Tennant, we had 60 hospitals and hundreds of ambulatory centers that were on all kinds of different things. And so the solutions I was interested in the Tennant environment were remarkably different than in the homogeneous Henry Ford environment. So in the Tennant environment, sort of solutions that could overlay a lot of disparity in technology and somehow normalize it were very attractive. In Henry Ford's technology environment, that was a distraction and it was waste and it was unnecessary. So I think as entrepreneurs also thinking about what does the ecosystem look like for a particular health system and how attractive does that make them as a customer or not. And honestly, when it comes to clinical things, another really important element is Henry Ford had pretty consolidated clinical decision-making structure when it comes to policies and approaches. In other systems I've been in, Tennant, that was very decentralized. So if you said, we want a standard way to do differential diagnosis, there wasn't even a person to talk to at an enterprise level. So the sales approach was sort of market by market. And in Trinity, it was kind of a hybrid. So I think recognizing, too, the level of consolidated power and decision-making in a health system versus decentralized is a really important thing to understand as well.
And I mentioned differential diagnosis and the treatment algorithms. That's actually not what we do. It's
Okay.
as a physician, that's what I've
Okay.
experienced in the past, and it's still out there, so.
Yeah.
Do you have any pearls for, streamlining your own integration? Because we found out, we just did a little pilot with another company last month, and we found like 50 EMRs in Florida that we're going to have to integrate with. Do you have any steps on, how would we ease integration with this kind of thing? I understand
With
what's-
early stage companies, the fastest path to broad impact, I think, would be health systems that have an attraction to your solution and have done a lot of standardization of their transactional systems. So I think as you approach different health systems, trying to gain some understanding of how standardized they are within their own platforms and using that information to prioritize from your perspective how attractive these are as customers. Because some places, that EMR story is not an uncommon one. And the risk for you is you think this is a relatively straightforward integration, and then you're like, I got to do integration X50. Now the thing that I told the customer was going to be $100,000 a year now is $1 million a year. And so I think gleaning that out kind of in your early discussion processes will help a lot. Integration is always really, really tough because the technical side of integration actually isn't that tough. What is the data mapping of, your solution is expecting certain fields to mean certain things and connect to certain other systems. And as we all know, people may have used the same field for all kinds of stuff. People don't get this about healthcare data. Like, you have a field, 1 byte, indicates gender. Okay, some places use an M, some use an F, some use other things. Some use a 1, some use a 2. So, I mean, this is the natty, this is why healthcare integration is so difficult. It's the lack of data standards. So if I were in your shoes, I'd, as I was approaching customers, try early on to ferret out how standardized versus how non-standardized their environments are. Does that help at all?
For the most part, because then we find ourselves running into like, oh, we just ran into $1 billion health system. Do we even talk to them? Are they too large? Do we talk to the one place that's just one practice, which may be lucrative, but if it costs $50,000 for us to build our integration, and we can only get 45 from them in total, is it worth it?
Yeah, and unfortunately, I don't know, other than the dialogue, like Trinity Health right now, about $25 billion a year in revenue. They're just finishing up a 6-year effort to completely standardize on Epic. They probably would be really attractive. Ascension Health, $30 billion a year in revenue. We could sit here for months and not list all the EMRs in that organization, So unfortunately, it's not like, even by the size of the organization, you can tell that much, right? So like a Trinity would be a super attractive place to start integrating new solutions because the degree of standardization, they're pretty much finishing right now.
So where would I even, this is my last part, I promise. Where would I even start to figure out what you just said about Trinity? Like, who?
So who would be the natural customer of your solution?
Care managers are going to be the ones who use our product the most, but the primary care physician will be the one who benefits the most from the work.
Okay, but the primary care physician won't get the benefit if the care manager doesn't do their thing.
Well, a private practice physician can also use the software. It's just like we expect care managers to be like, this will augment my workflow for the physician's benefit.
So there might be some basic questions you could ask, like one really basic one for you to understand as you approach health systems would be, what's your physician employment model with primary care physicians? Do you employ your primary care physicians in general or not, or are they independent practitioners? That would be one. Another would be talking to the care management people and saying, do you have one care management function for the entire enterprise, or is it really, market by market based? So you might want to think about designing sort of a little questionnaire that helps you discern some of those characteristics. And if that's something I can help with in some way, shape, or form, we can talk after or whatever.
I have your contact info. I'll shoot you an email.
Okay, I occasionally read my email now.
I'll find you something.
Okay, but you're raising a good point, and I think what we're both coming at is, one health system, one health system. And when you're in your guys' shoes, you have limited firepower. So how do you discern the right targets?
I have 5 other questions now that I'm not sharing. So we have a health and wellness model that is lifestyle medicine for fertility that plugs in really well with the conventional medicine model. Conventional medicine doesn't know how to educate appropriately with this, and we're a good, solid place to refer to. We have a physician champion in that Newport system. They like to refer, they want a button to network. And this is our dilemma here. And I know that I've worked with Xander and with Tarek and everything about how to move forward in this conversation. I can answer a lot of these questions. I guess we just don't know where to go next on that pathway. And if we do have precision medicine as a piece, I know you have integration, you have some functional medicine, and that's what we are. We are education and content-based, like a lot of what you're saying, we're checking all the boxes.
Yeah.
Henry Ford's going to be a tough place to sell into for the next 3 years, mainly because, the CEO might shoot me in the head if I said this, but it's honest. all the oxygen in the room is being sucked up by doing the joint venture with Ascension, and it's just going to be really very difficult to get attention of key people. And as an IT leader, I mean, I'll confess this. You have many different clinical areas coming at you saying, we found a way to advance our thing. And at some level you go, okay, but Henry Ford's invested heavily in oncology, orthopedics, cardiac, and, onco. And I've got more demand to do stuff there than I could ever do in a lifetime. So when someone comes forward with very legitimate, great solutions, but in areas that haven't been formally prioritized and recognized, it just becomes a more difficult conversation. And I don't know quite how to solve for that, other than to say the timing's got to be right. But I'd be happy to talk to you more and see if there's any inside baseball, kind of things I could share.
That'd be great.
Okay. Yes.
How is the cloud adoption when it comes to the healthcare generally existing, but also existing for Henry Ford?
Cloud adoption?
Yeah.
Yeah, I started at Henry Ford. Ooh, cramp in my calf. I started at Henry Ford in 2018, and during my entire tenure there, I don't think we implemented a solution that wasn't cloud-based. I mean, I think the mindset, not just in healthcare, but in healthcare, you can't even really buy on-prem solutions anymore. So if I were architecting solutions today, it'd be, a no-brainer. And within the health system IT function, I think every IT function in healthcare just recognizes now, you can't really buy new solutions on-prem and kind of expect. I do, again, don't quote me on this, I might get in trouble from somebody, I don't know. I do think if you look at the dominant players in healthcare tech, I would say Epic and Microsoft are lining up to be best buddies on a lot of things. And so if I were developing new solutions today, I'd probably have a bias for doing them in Azure. And I would say, on the other side of the coin, you have kind of informal, Google, Oracle / Cerner. And they appear to be doing more things together. And I think those are going to be like the dominant ecosystems in general. So if I had to pick one, I'd be developing within the Microsoft ecosystem, to be honest with you.
Can I ask you one last small
Sure,
question?
yeah.
So I think our companies are particularly, interested in how to. I know there's a lot of integration questions. So, like Cura has their own separate app, right? Elite Care has their own separate app. Like, how does that integration? If somebody's coming from the outside with an app and saying, "Hey, we have a solution,"
there's not going to be a lot of interest. There's going to be active resistance. A more open conversation is, I have a capability, how can I get it woven into your iteration of my chart? And, so Henry Ford Health, for example, if you look at I think 80,000 diabetics we treat annually, 75% of them have at least one other significant comorbidity, which means we don't have any interest in saying to a patient, we'd really love you to use this app that's designed for diabetic care. That's awesome. What we have a lot more interest in is saying, we'd like you to engage with us through my chart, and within my chart, you can get prompts and pings and information about your behavioral health, about your diabetic care, so we're trying, and most health systems are trying to do this. We went through the whole digital tech explosion, 2018 through 2022. Everybody had an app that behind it had a clinical model and some care coordination. And I think what many people learned, whether they were deploying them on the payer side or the provider side, is the engagement wasn't great. And we've been trying very hard within Henry Ford, and I think this is actually right to create one cohesive interface. Like you have one interface with Amazon. You don't you know, Amazon doesn't give you, you know, here's our app for clothes and here's our app for meds and here's our app, you know, for content. I go into Amazon.com and I go around and do my thing. And I think health systems are, particularly as they get more engaged in value-based care, treatment of the whole person and coordination of the whole person care is more important. And so I don't think, other than in niche situations, there's going to be strong support for apps that are particular to a disease condition or a type of patient. I think the more successful model is going to be content that can easily be put within whatever that wrapper is, you know, for a health system.
Thank you. I know we're out of time here, so first off, thank you for coming and appreciate it.
My pleasure. Thank you.